In schools across Connecticut, school-based health centers offer children of all ages a full range of physical and mental health care. New centers are being formed in rural, suburban, and city areas around the state as more and more communities learn from the success of others.
The school-based health center has been probably one of the most innovative and dynamic additions that we've made to East Hartford High School in the 6 years I've been here.
From parents calling me, to youngsters pulling on me, to my secretary, and everything that comes in between, I really need all the help I can get. And a school-based health center can truly make the difference in my work and the work that we try to do for kids.
Good girl.
They take care of me when I'm sick, and they make me feel better.
We were one of the first school-based health centers in a suburban area in the state of Connecticut. And that was largely driven by the fact that what you see is not necessarily what you get. My position is schools can't do enough to try to make sure that the world works well for children so that they can learn.
I think it's the support. It's knowing that if there is a child in crisis, if there is a family in need, that there is a resource to go to within our own building. We have about 97% of our families enrolled in the health center, so the response has been fabulous.
At school-based health centers, children are cared for by teams of skilled health professionals. If they're sick or injured, they can be treated immediately. Most go back to class, but if it's more serious, they leave with the right prescriptions or outside referrals. In some sites, children enjoy the benefits of full dental care.
Oh boy, beautiful teeth. It's such an exciting thing to have any dental facility available for children in this community who can't afford private care. And it's even more exciting to have it in the school system because it's so much easier. The greatest unmet health need is for dental care.
Yeah, it's a great idea.
We provide the doctor's office within the school so that we're in addition, above and beyond what the school is able to offer.
When I get hurt, I feel like I automatically know where to go so that they can help me with my problem, and they always do.
We used to have a nurse's room full of kids who needed to call their parents to go home. Now, we don't have the absentee rate that we used to. The kids are healthy, the parents have their needs addressed, and we're a better community for it.
I can get any help that I need. I can talk to somebody if I'm having any problems, or seek medical attention if I need any, so it's real easy.
Have any problems with the other shots?
Yeah, my arm fell off. I had to get it sewed back on.
No, you didn't.
We're not taking the place of their physician. We're supplementing the physician's care in a more convenient setting for the student. The most exciting thing is watching the kids go through their 4 years of high school and seeing them grow and knowing that we may have made a difference.
It's like your regular doctor. It's in the school setting, and it's easier for the child. It's better for them because they don't feel as nervous because they see the people all day, every day.
Most school systems are really very limited in terms of what they're able to provide in terms of mental health. They're really pretty swamped, and I think that the mental health component is just an incredible benefit additionally.
Many children face problems that make it hard for them to learn. School-based health centers provide qualified counselors who can help them and their families through tough times.
At Christmas time, my mom passed away, and Christmas morning, as a matter of fact, and it was very difficult for my kids to deal with that. And the health center really helped out.
If you get sick, or if you want to talk to somebody, and if problems at home or at school with teachers or friends, that they're always here, and you shouldn't feel uncomfortable to talk to them because you can trust them, and they'll help you out a lot.
I work with the teachers and the students to help them do better academically, which helps them to do better overall. I also run groups.
Excuse me, Christine. Why are you eating lunch with Cottrell?
We're just friends. Role-playing helps kids because it actually puts them in the situation. Not here.
No. I don't think this is really cool.
Hopefully it plants some seeds for them
you can go there anytime you are sick or you're feeling down about something in your life, and you always have someone to talk to and someone's always there.
I think it's a smart thing because not only it helps you, it gives you information.
I like it a lot. I feel wanted there.
You know, Bert? I do play therapy. Play therapy is a child-oriented theory that says if you let your child do creative things at their own time, that they can work through a lot of these problems. I love what they give me. I mean, they give me far more than I ever give them. I mean, I really enjoy their creativity, what they come up with, what they do.
Today, we face a lot of different issues that I as a student didn't face. The drug and alcohol situations, the chaotic family life. This gives the kids just another option, another service that they can use within their environment to get help.
All of their issues end up in school. And so in an academic setting where they're trying to concentrate and trying to learn, they need to be able to address those issues so they don't interfere with their education.
Early intervention is the key to helping them resolve their problems. So if they walk in school one day and they're not feeling well, physically or emotionally, they can come down and we deal with it right then and there.
You could trust the people that work here. You could talk to them about your personal problems, and you know it's confidential.
Funding for school-based health centers comes from state, municipal, and private sectors. Each center is tailored to the community it serves and run in collaboration with schools and a variety of community agencies. Among those familiar with school-based health centers in our state, you'll find very loyal supporters.
Through our funding, we try to send the message that we do think it's an important need in the community. And as a community foundation, our resources are there to meet the needs.
Because not everyone does have insurance. And even for the people who do have insurance, the opportunity to get the help when you need it, where you need it, is essential.
They make me feel safe, that nothing bad could happen to me.
Yes, you're nervous in the beginning, and most parents are with any situation. But after you've been able to be with the school base, you can understand and how great they really are.
I have a hot wire for my job here, with them, by telephone. If there's a problem with something that gets a little out of hand, they call me, and then between all of us, we try to get it resolved. I think they're doing a great job.
Sometimes my dad, he doesn't want to talk about it to me because, he's a guy and I'm a girl. So the school-based health center, he really appreciates it that they do that for him.
There are many people of many disciplines working together to ensure that the kids get the best care possible so they'll be able to study and learn and go on to succeed in life later on.
Let's go. Okay, great. Now, what did everybody get?
I feel great about it. It's just good and helpful, and
okay, great.
It takes away us having to rush out to the emergency room and be in the hospital for days.
What I would love to do is get the message across that all we're trying to do is give good quality health care to adolescents.
I don't know, I just love this place because they treat me so well, and whenever I need to talk to somebody, somebody's always there.
It's got to reduce the number of kids who, in fact, don't show up for school. I believe we probably nip some things early.
With myself, my body, emotional, physical, whatever, I can always come to them. And they've helped me in a lot of situations that I've been in.
Give them more money, expand the facilities, and encourage all parents to stop by, say hello, sign up, and take a look around. Because they can be your advocate with the school, and they can be your child's friend and support.
It feels good because I know that I have a safer place at school.
I think they're the wave of the future. Providing medical services in the schools is not only common sense, it's a necessity.
I think everyone should have a health center. It should be for all the kids.
They make me feel happy. Definitely, they cheer me up when I'm sad, or if I'm crying, they're always here for me.
It's really nice because you get to feel better and you get to keep going to school.
It makes me feel glad and proud that my school actually is one of the schools in Connecticut that have a school-based health center.
It's great.